Hi, my name is Lauren Hasquet. I'm with Ortho Montana. I'm a physical therapist. Today we're going to talk about plantar fasciitis. It's described as medial arch foot pain that goes into the heel. It can be very painful, especially those first couple steps in the morning when you put your feet down on the ground or when you're unweighting, like if you're laying on the couch watching TV and you put your feet on the floor, it can be very painful. So we're going to talk about 3 different things that you can incorporate in your day to help alleviate some of that foot pain. First, it's activity modification and changing up your training schedule. If you're starting to walk or if you're in a running program and you start to notice this medial arch foot pain, you're going to want to change up that training schedule. Second, orthotics. Going to the store and getting a prefabricated, non-custom orthotic to support that arch of the foot can be really helpful. And a therapist can help direct you into more custom if needed, but over the counter at first would be just fine. Third is stretching. Adding some stretching to the arch of the foot and the calves can provide a lot of relief to that plantar fascia. This is by no means comprehensive, and a physical therapist can help with your movement mechanics, but these are just some things to jumpstart your rehab. The first one we're going to go over is self-ball massage. So you're going to place a small ball, tennis ball or racquetball, whatever you have, underneath the arch of the foot. You can even try a frozen water bottle or a warm water bottle under the arch of the foot. You're going to press your foot into it while rolling it around, massaging the bottom of your foot. Do this as much as you like. If it feels good, you can do it multiple times a day. I think filling the water bottle with warm water in the morning to help warm up the tissue at the bottom of the foot right away feels best. And then after it's been really sore in the day, going to an iced water bottle and massaging the foot is a nice relief. Standing plantar fascia stretch. Stand with your foot against the wall with your toes pointing upwards. You're going to slowly lower the ball of your foot down to the ground, maintaining the toes up towards the ceiling. Bring your hips forward or your knee forward towards the wall until you feel stretch in the bottom of the foot. You're going to hold this for 30 seconds. You're going to want to perform this 1 to 2 times a day. This does provide a nice relief to the plantar fascia and stretching out some of that tight and tender tissue. So you can perform as many times as you'd like as long as it provides relief. The next exercise we're going to go over is calf stretching. We're going to do this on a step, or if you have a book at home, you can use that in replacement of the step. We're going to break this into 2 different exercises to make sure we break apart the calf into the gastroc and the soleus to get both muscles. You're going to start by standing on a step or the book with the heel off the edge. The balls of your feet should be on the edge of that step. You're going to lower your heels towards the floor to feel a gentle stretch in the back of the lower leg. Your toes of your feet should both be pointed forward, and you're going to keep your knees straight. This will stretch the gastrocnemius. Hold this for 30 seconds. Do it 1 to 2 times a day or more if you feel like the calf is getting a little bit tighter. Now we're going to go into the soleus stretch. In the same position, you're going to bend your knees slightly to feel this stretch a little bit lower. This is the second muscle in the calf, called the soleus. Hold this stretch for 30 seconds. Perform 1 to 2 times per day. These are a few exercises to initiate at home for plantar fasciitis. At no time should this video be a replacement for physical therapy. A professional physical therapist is trained to look at movement and make sure that you are moving well, and to progress or scale down exercises as needed. They can also help with proper form to reduce risk of compensation and further injury to other body parts. If you have any questions, feel free to contact us at Ortho Montana by either email or phone number, which will be attached at the bottom.